Hi there, I'm Marty Oppenheimer. I'm 72 years old, and 3.5 weeks ago I had total knee replacement of my right knee. It was pretty well shot due to osteoarthritis, and I'm making, I think, great progress. I get a lot of comments from both people who've had knee replacements and therapists that, wow, you're already doing this and you've got this much range of motion, that's great. And one of the things I think that helped out a lot is I was in such pain, I decided to do physical therapy before. And I got to integrated physical therapy and was trying to work on pain mitigation. But they helped me with a couple of things. One was my posture and walking, which did help a little bit with the pain. But the other was they stressed the necessity of keeping the leg as strong as possible prior to the surgery so that the recovery would be that much easier. And for me, I would have to say it's worked completely.